primary cause of mortality is the effect of potassium on cardiac functions. As potassium levels increase in the extracellular space, the magnitude of potassium gradient across the cell membrane is reduced, and so is the absolute value of the resting membrane potential. Membrane voltage becomes less negative, moving closer to the threshold potential, making it easier to initiate an action potential. The effect this has on excitability of myocytes, however, is complex. While initial changes seem to increase myocyte excitability, further rise of potassium has the opposite effect. This is because the value of membrane potential at the onset of an action potential determines the number of voltage-gated sodium channels activated during depolarization. As this value becomes less negative in hyperkalemia, the number of available sodium channels decreases, resulting in a slower influx of sodium and subsequently slower impulse conduction. In experimental models, ECG changes produced by hyperkalemia follow a typical pattern that correlates with serum potassium levels. Peaked T-wave, P-wave widens and flattens, PR interval lengthens, QRS complex widens and eventually blends with T-wave. In practice, however, this pattern is present only in a fraction of hyperkalemia patients and does not always correlate with potassium levels. This makes diagnosis on the basis of ECG alone very difficult. Given the dangerous nature of acute hyperkalemia, it must be suspected in any patient having new bradycardia or conduction block, especially in those with renal problems. Severe hyperkalemia is treated in 3 steps. Calcium infusion is given to rapidly reverse conduction abnormalities. Calcium antagonizes the effect of potassium at the cellular level, stabilizing membrane potential. However, it does not remove potassium and should not be used in the case of digoxin toxicity. Insulin is administered to stimulate the sodium-potassium pump, promoting intracellular shift of potassium. Hemodialysis is performed to remove potassium from the body. Longer-term treatment for hyperkalemia without conduction problems consists of reducing intake and increasing excretion. Thank you for watching. Please feel free to suggest a topic you want us to cover by leaving a comment below.